Okay, we've done a Facebook Live before, and we also have done YouTube Live, and we talked about what is like kind of classic stenosis. Stenosis is basically, especially in the lumbar spine specifically. And when we talked about lumbar stenosis, we talked about a few things that like kind of how it looks, and if you have stenosis, some of the things you might be experiencing. Today we're going to talk about a few exercises, my top exercises for stenosis. If you truly have stenosis, you'll benefit from it. If you don't, and you're trying to self-diagnose, these may not help you. So remember, whatever you do, these should not make your condition worse, okay? So if you're experiencing more pain afterwards, weakness, you feel more fragile, you feel more sensitive afterwards, if it lasts longer than a minute or two, it's not good for you. This is supposed to help you. So within about 3 days, I want to see a change that your stenosis pain, whether it be leg pain or just back pain, is less intense, it's happening less frequently, and doesn't last as long. So really keep that in mind, that we want to be careful that we listen to those 3 things. Another thing, in addition to those 3 things, we also want to realize that when we start this exercise, any of these exercises that I tell you about, you shouldn't have the pain, and I'll explain the quote, moving away or coming closer to you. So if you start out with pain in your calves, and you say it's radiating down, when you start doing, let's say, one of the stretches I give you, the pain should start moving upwards, or at least not being as intense. Let's say you start out with buttock pain right here and lower back pain. If it starts moving down as you're doing the exercise or immediately following the exercise, then you want to stop. So going away from the back, more pain, bad. Moving up, but you got to know when you start it. When you first start the exercise, what am I feeling? Where is the pain? So you want to look at that, make sure you don't have that pain start radiating down further, or you feel weaker, more numbness, more intense symptoms further down. Okay, so I think we clarified that. Real quick, we went over this the other day, what stenosis is. And it's a narrowing. Stenosis is just a narrowing of an area, a vessel, a region of the body. We're going to show you this little higher in the lumbar spine here. Most of our problems occur actually, that we have problems with, are actually in the lower 2, the L4 and L5 regions, and just above the sacrum, this triangular bone. That's where a lot of our problems come from. But anyway, the area that we're talking, that stenosis, that's narrowed, is right where this nerve root is exiting, okay? So this is depicting a nerve root. This segment and this segment, when they come together, make up a little hole called the intervertebral foramen. Fancy words. It basically creates a hole where the nerve root exits from the spinal cord, and the nerve root goes out and then down your leg. So this foramen, this area right here, can be narrowed from a disc bulge. It can be narrowed because you have a decrease in disc height, and this actually gets narrower because these 2 segments come together. But basically, the stretches that we're trying to give you are trying to open up that area and increase the area where that nerve is. Okay, so we're going to show you on the board here. So this is the foramen right here. So let's go ahead and go over that. So if you're increasing the hole, so if we're increasing that hole, it's just like when we're doing these stretches. If the hole is generally this big, the nerve root comes through and comes out of that hole. When we do the stretch, we're trying to increase the size of that area and open up that area that the nerve root comes out of, okay? If there's any kind of scar tissue here, trying to open that area. If there's inflammation around that nerve, that can give you numbness or tingling down, and we're trying to open that up. And if we do it repeatedly, if it's something that's not structural, like really bone that's actually in the way, we actually may be able to free that up and you start feeling better. And a lot of back issues, traditional back issues, will resolve in 2 to 3 months, okay? Even if you didn't receive treatment. This is supposed to try and accelerate that process and start making you feel better. So that's the idea. Stenosis, just narrowing. Just like in the heart, you can have a narrowing of vessels that potentially lead to heart attacks. This is a different type of stenosis. So that's stenosis. So we're going to talk about our top exercise that I give you. Now I like to start out with exercises when you're lying down first, where you're not in weight bearing. They tend to be a little gentler and a little safer. So as we do that, we're going to have you just lie on your back. This is one of the ones we'll start out with, just a gentle knees to chest. Okay. Both hands like so. It can go on the top of the knee or below here. You're simply going to go pressure on and pressure off. Try and relax your neck so you don't you're not pulling and doing a crunch. It's really the arms coming back. We're opening up here. We're trying to create a flattening and opening up that area like that. So pressure on, pressure off. Okay. Some patients will get a lot of relief from just doing that. If you don't, or at least it's neutral, it's not worse. Well, it says, they'll come to me and say, Tom, I felt better, but it really didn't change how I felt. Another one that's another step up is doing one, let's say in sitting or standing. The one I prefer is really sitting, okay? So you're gonna widen your legs, make sure you're at the very edge of your chair. You're gonna take your hands down like so, and you're gonna rock forward like this until you feel steady pressure. Your lower back is feeling a little stretched. So you're gonna feel pressure on, and then pressure off. So pressure on, you wanna go to the very end of the range, and pressure off. If you don't get to the end with the knees to chest, or this exercise, it can really create some problems for you, meaning it won't really change it. You may stretch it, but you gotta get to the end of the motion and really feel that good pull. So I'll have people that'll actually pull on their ankles a little bit so they get a little bit more of a stretch. Same thing with the one on your back. You wanna get that good knees to chest all the way up. Another one that kind of helps out too is just doing, typically if symptoms on one side, we'll bring one leg up and simply come forward like this. So pressure on, and then pressure off. Pressure on, pressure off. Now, the way I've been trained is more of a McKenzie way of approaching these things. I'll start with like a 1 second hold. I'll do it 10 times every 2 to 3 hours, typically every 2 hours. The sweet spot is right around 5 sessions per day. So whatever stretch we start out with, we do the one lying down or the one here, we want to do that frequently throughout the day. And cumulatively, it's supposed to add up to make you feel a little bit better, okay? If you're having stenosis as far as sleeping and such, another thing to do is to use a roll underneath your legs. Let's say you're sleeping on your back or your side, or roll it in between your knees. That'll lessen it. I'll kind of open up the air around the back. So when you're lying down, just to go back to here, we want to have our legs up a little bit, like that. So you've got something underneath, maybe a couple pillows underneath here. That'll lessen the pressure in the lower back and typically flattens the lower back area. Some people will also do a gentle like single knees to chest, which I didn't say earlier. Okay, sometimes that's better tolerated. Get a little bit more force like that. Okay, but really getting the legs up for sleeping tends to feel a little bit better. If you're lying on your side, placing a pillow between your knees here and also your upper arms, like a full body pillow, that'll feel more comfortable as far as sleep positions. Especially with stenosis, you really want to avoid any kind of lying on your stomach for multiple reasons. It really causes problems for people with stenosis. In some cases, this narrowing is not related to arthritis or whatever. Sometimes, in rare cases, I just kind of throw it out there, sometimes you have a really large disc bulge, and it actually feels better when you flex it. Traditionally, people think of like disc herniations and bulge. A lot of times we'll give people, they seem to respond better to that arching one or that side stretch. But in some cases, really large bulges, they feel better. But the key is that you should have more symptoms. You should have more tingling, numbness. You should feel better afterwards. This isn't a no pain, no gain. If I keep on working on this, maybe in a couple weeks after suffering, I'll feel better. That's not the case. It really should be something that changes. Some stretches in therapy, I'll tell people, you gotta, unfortunately, it's gonna be a little painful when we go through this. These particular stretches you really want to be more careful with. It's not uncommon to feel pain at the very end of the motion, but once you release the stretch, like when I was doing the knees to chest or the one I was coming forward like this, okay, you may feel pain in the middle of the stretch, but once you release the stretch, very soon after that, 1 or 2 minutes afterwards, you want to feel like it feels better. So those are some of the top stretches for stenosis. We talked about stenosis more in my previous videos, so if you need to, you can check our playlist and you can take a look at the previous video. We kind of go into more like how it feels when you walk, like classically stenosis. But the term stenosis is used a lot, and sometimes it's not well understood. It scares a lot of people. I hope this gave you some more things that you could possibly work on. Nothing is better than a full evaluation by your therapist as far as the best exercise, because truly when we look at people here in the clinic, we're taking them through a series of movements. Some of them are arching, some are flexion. We're trying to see the one that makes their condition feel better and actually improves their range of motion. So just keep that in mind when you're doing it. So I hope that helps you out a little bit. If you like it, please subscribe, like our page, and share, or give us comments. I want it all. So let's try some of those things and let's feel a little bit better and move forward, okay? All right, have a great day.